Welcome to stimulus control, one of the most frequently tested concepts on your BCBA exam. Stimulus control occurs when a behavior is more likely to occur in the presence of a specific antecedent stimulus because that stimulus has a history of signaling reinforcement. Think of it as the environment guiding your client's behavior, whether the child saying please only when a parent is looking, or a learner selecting a red card when told point to red, but not when told point to blue. In this session, we'll break down the discriminative stimulus, SD, and the S-delta, distinguish stimulus control from motivating operations, and explore the 4 key components that make up a stimulus control relation. You'll also see real-world examples and learn the critical difference between simple and conditional discriminations. Mastering B12 means you can identify when an antecedent truly evokes behavior versus when it merely sets the occasion, a distinction that appears in both multiple-choice questions and scenario-based items on your exam. Stimulus control is a foundational concept for the BCBA exam, and this slide breaks down its core components. The discriminative stimulus, SD, evokes a behavior because, in the past, that behavior has been reinforced only in its presence. This is due to a history of differential reinforcement. In contrast, the S-delta, signals that reinforcement is not available, so the behavior becomes less likely. Stimulus discrimination is the process of behaving differently in the presence of these 2 stimuli, such as saying hello when a friend approaches, SD, but not when a stranger walks by, S-delta. Stimulus generalization, however, occurs when a learner responds to similar stimuli without direct training, like greeting anyone who looks familiar. Conditional discrimination adds complexity. The function of one stimulus depends on another, as in matching to sample tasks where a red card only signals reinforcement when the sample is also red. For the exam, expect questions asking you to identify these examples and scenarios, such as recognizing when a child asks for a snack only when a parent is present, SD, versus when a grandparent is present, S-delta. Mastering these distinctions is critical for designing effective teaching procedures. On this slide, we're breaking down the 3 antecedent variables essential to understanding stimulus control, a core concept for the BCBA exam under B12. The discriminative stimulus, or SD, signals that reinforcement is available for a specific behavior, evoking that behavior due to a history of differential reinforcement. Think of a green light prompting you to drive forward or a client handing over a ball when you say, "Give me ball." The motivating operation, or MO, alters the value of a reinforcer and the frequency of behavior that has produced it. For instance, food deprivation makes candy more reinforcing, increasing the likelihood of behaviors that previously earned candy, even without an SD present. The S-delta signals that reinforcement is not available, suppressing the behavior, like a red light stopping your car or a do not enter sign preventing entry. On the exam, you'll need to distinguish these variables in applied scenarios, recognizing how they jointly shape stimulus control and guide intervention design. On this slide, we break down 4 key components of stimulus control that are essential for the BCBA exam. Stimulus discrimination training is the foundational process where a response is reinforced in the presence of an SD, but not in the presence of an S-delta, teaching the learner to differentiate. The stimulus generalization gradient visually demonstrates how responding spreads across similar stimuli, with the highest rate near the training stimulus, a concept you might see on a graph interpretation question. Conditional discrimination involves a more complex relation, like matching to sample, where the sample's stimulus determines which comparison is correct. This is critical for understanding how learners respond to contextual cues. Finally, errorless learning uses prompts and fading to establish stimulus control with minimal errors, a practical strategy for efficient teaching. On the exam, expect to identify these components in scenarios, such as recognizing when a therapist uses errorless learning to teach a child to discriminate colors, or interpreting a generalization gradient from a DTT session. On this slide, we distinguish stimulus control from motivating operations, a critical distinction for the BCBA exam under task, list item B.12. Stimulus control, exemplified by the discriminative stimulus, SD, evokes behavior because it signals a history of differential reinforcement, like the instruction, "Give me ball," evoking handing over the ball. In contrast, motivating operations, MOs, alter the effectiveness of a reinforcer and evoke behavior that has previously produced it, such as food deprivation, making candy more reinforcing during therapy. Notice the SD's function depends on correlation with reinforcement history, while MOs rely on deprivation or satiation states. Crucially, these can operate independently. An SD can be present without an MO, e.g., food available but not hungry, and an MO can exist without an SD, e.g., hungry but no food present. For the exam, you must identify whether a behavior change is due to stimulus control, SD/S delta, or an MO, as each requires different intervention strategies, such as discrimination training versus motivating operation manipulations. On this slide, we see how stimulus control operates across everyday and clinical settings, a critical concept for the BCBA exam under B.12. The traffic light example is a textbook illustration. A green light functions as an S, evoking driving forward because that response has been reinforced in its presence, while a red light serves as an S delta, suppressing that behavior due to a history of extinction. In a classroom, the teacher's question becomes an S for hand raising, whereas silence is an S delta. This shows how differential reinforcement establishes stimulus control. Matching to sample tasks introduce conditional discriminations, with a sample stimulus, e.g., a red circle, alters the function of the comparisons, making the correct match an S only in that context. Token economies rely on the token board as an S for earning tokens, linking behavior to backup reinforcers. Prompt fading demonstrates how stimulus control shifts from artificial prompts to natural stimuli, a key skill for practitioners. Finally, verbal behavior control highlights how different SS evoke distinct responses. For the exam, recognize that stimulus control is not automatic. It results from a history of differential reinforcement, and these examples show how to identify it in practice. On this slide, we're breaking down the critical distinction between simple and conditional discriminations, a key concept for the BCBA exam under stimulus control. In a simple discrimination, behavior is controlled by a single antecedent stimulus, like pressing a lever when a light is on, the SD, but not when it's off, the S delta, because only the light's presence has been differentially reinforced. Conditional discriminations are more complex. The correct response depends on an additional conditional stimulus. For example, in a matching to sample task, selecting a red card is correct only when the sample is red, but you must choose blue when the sample is blue. Here, the function of each comparison stimulus changes based on the sample. For the exam, remember that simple discriminations involve one antecedent controlling behavior, while conditional discriminations require the learner to attend to multiple stimuli and their relations. This distinction is foundational for designing effective discrimination training and understanding how learners navigate increasingly complex environments. Establishing stimulus control is a deliberate, systematic process that BCBA candidates must master for the exam, as it underpins effective teaching and behavior change. It begins with selecting target stimuli, clearly defining the discriminative stimulus, SD, that should evoke the behavior, and the stimulus delta, S delta, that signals extinction, ensuring the SD is relevant to the learner's natural environment for meaningful generalization. Next, differential reinforcement is applied. The target behavior is reinforced only in the presence of the SD, while reinforcement is withheld in the presence of the S delta, creating a clear contingency that strengthens discriminated responding. Prompting and fading then help evoke correct behavior initially, using verbal, gestural, or physical prompts, which are systematically removed to transfer control to the SD alone. Finally, you assess and generalize by testing stimulus control across different settings, people, and times, a critical step for exam questions on maintenance and generalization. This process directly applies to discrimination training and conditional discriminations, where you must identify whether stimulus control is truly established, not just temporary prompt dependence. On this slide, we examine 3 core procedures that establish stimulus control, a critical concept for the BCBA exam under B.12. Discrete trial training uses a clear discriminative stimulus, like touch red, where correct responses are reinforced and incorrect ones undergo extinction, building stimulus control through repeated trials often for simple or conditional discriminations. Errorless learning proactively prevents errors by using prompts that are systematically faded, transferring control to the natural SD while reducing learner frustration. This is especially effective for learners prone to errors or with learning challenges. Matching to sample presents a sample stimulus, requiring the learner to select the matching comparison from an array, reinforcing only correct selections to teach complex conditional relations such as identity or arbitrary matching. Foundational for equivalence-based instruction. For the exam, you must recognize how each procedure systematically arranges antecedents and consequences to evoke discriminative behavior, ensuring that the SD reliably controls responding while S deltas do not. Understanding these distinctions helps you identify stimulus control in practice and select appropriate teaching strategies. When studying stimulus control for the BCBA exam, you must understand the 4 key factors that determine how effectively a discriminative stimulus evokes behavior. First, the reinforcement schedule matters. Continuous reinforcement during initial training strengthens the SD behavior relation, while intermittent reinforcement can weaken stimulus control over time. Second, stimulus salience plays a critical role. Bright, loud, or novel stimuli are more likely to acquire control, especially for learners with attention difficulties. Third, the history of reinforcement is essential. A longer, more consistent history of differential reinforcement produces stronger stimulus control, making the SD more reliable. Finally, similarity between the SD and S delta affects discrimination. When they are very alike, discrimination is harder and requires more training, whereas greater differences make discrimination faster. On the exam, you may be asked to identify which factor is impacting a client's performance. For example, why a child responds correctly in a bright, quiet setting but not in a noisy one. Recognizing these variables helps you design effective discrimination training programs. Stimulus control is a foundational concept for the BCBA exam, and it's critical to clear up common misconceptions that often trip up candidates. First, an SD does not cause behavior. It merely sets the occasion for a response that has been reinforced in its presence. The behavior itself is maintained by that reinforcement history, not the antecedent alone. Stimulus control is not automatic. It must be systematically taught through differential reinforcement, meaning the learner only responds correctly after explicit training that distinguishes relevant from irrelevant cues. It's also essential to differentiate an SD from a motivating operation. The SD signals which behavior will produce reinforcement, while the MO alters the value of that reinforcement. They are distinct antecedent variables. Be aware that stimulus control can become too narrow as an overshadowing or restricted stimulus control, where a learner attends only to a single feature of the SD. Finally, stimulus generalization is not a failure. It is adaptive when it occurs across appropriate stimuli, like all red objects, but problematic when it spreads inappropriately. Remember, stimulus control is dynamic and can shift with new learning, extinction, or changes in MOs. On this slide, we distinguish stimulus control from response generalization, a key distinction for the BCBA exam under B.12. Stimulus control means a specific antecedent stimulus, like the sight of a ball, evokes a particular behavior because that behavior has been reinforced only in its presence, while other stimuli, such as a car, serve as S deltas and do not evoke the response. In contrast, response generalization involves a learned behavior spreading to topographically similar responses without direct training. For example, after learning to say ball, a learner also says doll or wall. The critical process for stimulus control is differential reinforcement across stimuli, shaping precise antecedent behavior relations. For response generalization, it's a behavioral cusp enabling generative learning. On the exam, you might assess stimulus control by testing whether the behavior occurs only with a trained stimulus, whereas response generalization is evaluated by presenting untrained but similar response forms. Understanding this difference helps you design interventions that either narrow stimulus control or expand response repertoires. To succeed on the BCBA exam, you must master identifying stimulus control by systematically applying these tips. Always start by locating the SD. The specific stimulus that signals reinforcement is available for a behavior, which evokes that behavior due to past differential reinforcement. Crucially, distinguish the SD from a motivating operation. MO, the SD, tells you which behavior will pay off, while the MO alters the current value of that reinforcer. Remember that genuine stimulus control requires a documented history of differential reinforcement. If a scenario doesn't show reinforcement occurring in the presence of one stimulus but not another, you cannot claim stimulus control. Next, identify the S delta, which signals extinction and suppresses behavior. For more complex items, recognize conditional discriminations where the correct response depends on a sample stimulus, like matching to sample tasks. Finally, ground your understanding in real-world examples. A ringing phone is an SD for answering, a stop sign for stopping, a teacher's question for raising a hand. Practicing these steps will sharpen your ability to analyze exam scenarios accurately. As we wrap up stimulus control, remember that at its core, this topic is about how specific antecedents, the SD and S delta, evoke or suppress behavior due to a history of differential reinforcement. You've learned to distinguish stimulus control from motivating operations, recognize the difference between simple and conditional discriminations, and identify the 4 key components that define a stimulus control relationship. For the exam, focus on recognizing real-world examples where a behavior occurs reliably in the presence of one stimulus but not another, and avoid confusing stimulus control with reinforcement schedules or extinction. A common trap is misidentifying a motivating operation as an SD. Remember, MOs alter the value of a reinforcer, while SDs signal its availability. Mastery here is essential because stimulus control underpins discrimination training, generalization, and complex verbal behavior. You've built a solid foundation. Now trust your analysis, practice with mock scenarios, and walk into that exam ready to identify stimulus control with precision. You've got this.